Hello everyone, my name is Sherifat Abdusalam. I'm here today to perform intradermal injection administration. First, I've gathered my supply. I have the glove, this is the injection site. I have alcohol swab, I have the needle, I have my gauze and the band-aid. I have the vial, tuberculin vial, and I have this for hand hygiene. First thing to do is to verify physician's order to make sure it aligns with the medication rights, which is to have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Once I've done that, I'm going to verify this with the EHR to make sure it's well transcribed. The order says to administer tuberculin skin test intradermally of 5 TU by 0.1 ml times 1 dose. Once I've confirmed that, I'll calculate the dosage. If I have to do the calculation, I'll use doctor's order over what I have in hand times volume. But for this order, what I have in hand is already in ml. I only need to draw 0.1 ml. After this, I'm going to gather my supply and then go to the patient's room, knock knock, provide privacy. If there are people in the room, I'll ask the patient if they want them there. This is for HIPAA protection. I'm going to introduce myself to the patient. My name is Sherifat. Identify the patient 2 ways, verify that with their wristband. I'll ask if they have any known allergies to food, drug, or seasonal allergies. Once they say they don't have that, I'll then proceed by explaining the procedure to them. The purpose of this visit is to carry out a tuberculin skin test by injecting the tuberculin under your skin. Once it's injected, you're going to feel a slight burn, which is normal. That's what we're going to use to measure if you're exposed. What the skin test does is the tuberculin does is to track or trace if you have any tuberculosis bacteria in your system. What will happen again is at the site of the injection, you might feel some stinging or some biting when it's being given. This is normal. However, if you now experience some rash and other, we'll have to abandon that test and redo the test afterwards. Some of the common side effects you're going to experience is to have some redness around the site. You can have some injection site rash. You could have some swelling, and like I said, you could have some bump. However, it becomes some adverse effect that you could feel is to have some difficulty breathing, or you could be experiencing some fainting spell, and then you could have a very hard bump. Once you feel that, kindly notify the staff. Do you have any question for me? If the patient says they don't have any question, I will then perform hand hygiene, wear my gloves to do the injection administration. So for this, before I start this one, I'm going to check again to take out the medication. I'm going to go back to the EHR. The order stays to get the tuberculin test. I have the tuberculin vial here. It's in 5 ml. It has not expired, but once I open it, I'm going to label it because it has to be discarded within 30 days. Once I take that one out, I have my needle. My needle is already in 1 ml. It's a 25 gauge 5/8 inches needle. It's already labeled 0.1 to 1.0 ml, so it's easy for me, it's easy for me to draw. So I'm going to take that one out as well. Once I have that, to do the medication administration, to draw the medication, I'm going to first of all wipe the surface of the vial with alcohol swab. I have my trash in front of me. And once that is done, I'm going to, since the order says 0.1 ml, I'm going to push 0.1 ml of hair into my plunger, still with the cap on, and I'm going to push that air in before I draw the medication. Flip the medication, turn the vial over inversely, and then draw up the 0.1 ml. If there are bubbles, I'm going to tap. If I still want the bubble to be pushed up, I'm going to flick from the bottom to push the bubble up. Once I have the injection, I'm going to remove the vial gently without bending the needle, and then I'm going to do 1 hand scoop to recap it. Since this is done, I'm also going to check to verify that this is in line with what is in the EHR. So the order is to have tuberculin skin test and administer 5 TU over 0.1 ml. I have the tuberculin here, 0.1 ml. It's supposed to be administered intradermally and is 1 dose, which I'm going to do. If the patient is not with me when I drill the insulin, I'll label it with the patient's name and the dosage on it before going to the patient's skin. Once I've done that, I will then place that down. I'm done with this one. Then I'll get the site of the administration. For the site of the administration, I'm using the forearm, and how I'm going to get that is to do 3 to 4 fingers with below the antecubital area and also the antecubital space, and then 1 hand width above the wrist. That's how I'm going to locate the site. Once the site is located, I'm going to visually check the site to make sure there is no discoloration, there is no bump. I'm going to also pap it to see that there is no bump, there is no bruising around it. Once the skin is intact, then I'm going to get the alcohol swab and clean the seat and clean the skin. I'm going to clean the skin from, rotate it inner to outward in 5 mm. I'm going to do it from inside to outward 5 ml. I'm not going to pat dry. I'm going to let it air dry on its own. I'm not going to pat dry. Once that is done and the site is dry, I'm going to take my needle. The way to administer this is to make sure the bevel is up, facing up, because I'm going to the epidermis. I'm going to go in at 3 mm. If I meet any resistance, that means I've gone deeper under the skin. I'll have to withdraw the needle and start all over. However, if for the administration, I'm going to go in at 3 mm at an angle of 5 to 15 degrees. And I'm going to do that way. So finally, I'm giving the medication. It's aligned with the EHR order. I have tuberculin 0.1 ml. I'm giving it intradermally. Take the cap off, bevel up, and then I'm going to go. This is my dominant hand. With my non-dominant hand, I'm going to stretch the skin, and I'm going to go gently. Like I said, if there's any resistance, it's because I've gone too deep. Once that is done, I'm going to push that one in gently, and then I'm going to remove the needle gently. At this point, I'm going to see a wheel come up, like almost looking like a mosquito bite, and that's what's going to be the site. I'm going to put a gauze right over the surface. I'm not going to press, I'm not going to massage it. The needle will not be recapped, it will be discarded. This is a safety needle. I can just push it up to do that before discarding. Otherwise, the needle should not be closed again. Discard into a waste box or any kind of biohazard bag around. Once that is done, if needed, I can put a band-aid over the site. If not, for the patient's preference, if not, I can leave the site open. At this time, the medication administration is complete. I'm going to gather all my used supply. The ones that should be discarded will be discarded. I'm going to gather the supply, drop them where they're supposed to be, remove my gloves, perform hand hygiene, and then document appropriately. Thank you.